happens to soldiers.
Mm-hmm.
And so we want to be able to quantify that so that policy can be made to help better track soldiers and provide services to them to try to reduce the risk of mortality.
All right. So the application was basically to try to reduce the risks, right?
Yes.
So were you able to do that?
Well, so the thing is, it was just an exploratory study, so it's going to
Mm-hmm.
be a paper that's published. So, um, hopefully, uh, different agencies and different interest groups will be able to take the study and to look at the numbers of reporting and then create policies from there or
All
interventions.
right. All
Yes.
right.
Mm-hmm.
Right. So, and did you recommend any courses or any actions based on this?
What's the study? We I don't have it on hand. We did like create like a way forward, but it was more of a descriptive study, so it was more reporting the numbers versus um, writing recommendations.
All right.
Hmm.
All right. Let's see. I think that's sufficient for this one. I'll move on to the research section in your resume. Right. So,
Hmm.
you were also conducting some primary research, right? Because it says that you were developing surveys.
Yes.
All right.
So
So,
I've. Hmm.
yeah, go on. I'm sorry.
No, you can go ahead. I'm sorry. Go ahead.
All right. So, did you improve the design of these surveys in some way, or did you create them from scratch? Could you elaborate a bit on this?
So um, we are often asked to do epidemiologic consultations
Mm-hmm.
based upon the needs of different stakeholders. And there was one stakeholder that was interested in like occupational stressors. And
Mm-hmm.
so I feel that during that time when I was assisting with the survey development, I was very helpful in finding questions that targeted specific occupational issues,
Mm-hmm.
and finding other surveys that would kind of have already been gone through like a kind of quality assurance process. So I identified different questions that looked at occupational stressors. Um,
All right.
I'm not sure if I answered your question.
No, no, that's that's sufficient.
Hmm.
Right. So it also says that again, I think I've talked to you about this before, but I'm not sure if this is referring to the same project, so I'm just going to ask. It says in your resume that you were assessing risk factors for sexual assault and suicidal behaviors. So can
Yes.
you elaborate on these risk assessments that you were performing?
So that was a study that actually has recently been published. And I started that very early in my time with the Army Public Health Center. So I was pretty much
Mm-hmm.
the analyst. I ran the data. Um, so we were just looking at uh, whether we were looking at the association between a history of sexual assault and suicidal behaviors,
Mm-hmm.
and we looked at various health behaviors that are potentially associated with those two conditions.
Mm-hmm.
So that was we did like a multivariate analysis using logistic regression
Mm-hmm.
to assess confounding factors on sexual assault and suicidal behaviors. And that paper, initially we were looking at males and females, but at the
Mm-hmm.
request of the journal that eventually published the paper, we just limited it to females.
Mm-hmm.
Um, and a lot of the correlates that we use in our model were correlates that have already been found in other populations to be associated with sexual assault and suicidal behaviors such as PTSD, um, family history of
Mm-hmm.
suicidal behaviors. Yeah, I'm not sure if I addressed your question though.
Oh, no, no, that's fine. So, again, in this one, did you recommend anything to mitigate these risks?
Um, I would have to look at the paper. For the recommendations we suggested. But the Army has a pretty they're very aggressive and in terms of prevention of sexual assault.
Mm-hmm.
Um, they have a lot of programs to address and prevent sexual assault. So basically, we kind of expanded on those and just included those programs in the paper,
Mm-hmm.
so that the readers would know that there are policies in place, but also recognize that it's still a continuous problem within a military environment.
All right. So, what about the other way around? Have you been able to influence the policy in the army through these papers that you've published?
Well, it's kind of hard to say because once you put information out there, we
Mm-hmm.
don't know exactly what army leaders do with the information, and then we haven't like really evaluated how they're using the information. However,
Uh-huh.
I do know that when we do report out routinely information to stakeholders, the request for information, our stakeholders do tell us that they take our numbers to create policies and interventions to to prevent whatever behavioral health issues we're reporting on.
Mm-hmm. Okay. All right. So we've talked about two of the major projects that you worked on. I believe we haven't talked about the judicial outcomes one. That was the
I'm
third, right?
sorry. Say it again.
You said that you were a project lead for some judicial outcomes for the U.S.
Yes.
Army.
Uh,
Yeah.
yes. So that project actually recently was approved by our Public Health Review Board.
Mm-hmm.
So that project is in the process right now. I've been working. So we're using a different platform to receive our data. It's called the Person Data Environment, and it's run by the Army Analytics Group. So it's a new platform that a lot of researchers or epidemiologists within, I wouldn't say researchers, I would just say epidemiologists within the Army Public Health System, they have not used this platform before. And so
Mm-hmm.
I would say that this study was sort of like I'm trying to think of the word, like uh, um, goodness. I'm the only word I'm thinking of is pioneer, because we were
Uh-huh.
kind of one of the first people within our division to look at using the PDE. Um, but since then, other people have actually started getting data, and we're still in the process of getting the data for our study. So um, I was responsible for communicating with Armor Analytics Group, trying to understand what are the policies that are needed to capture the data and to get access to the data.
Mm-hmm.
Um, I was a part of the team that wrote the application for the study to be approved. Um, and right now, I'm working with some other epidemiologists to bring in some stakeholders who we could potentially send the project to after we complete it, who may be
Mm-hmm.
interested in the results of the paper.
Okay. All right. Let me see.
And
Sorry,
I
just
guess
a second. I'm just.
basically, uh-huh.
Yeah.
I
Go
just want
on.
to say basically we're looking for champions who can support the project.
All right.
Mm-hmm.
All right. So, tell me about this field investigation thing that you did. What was the aim of these investigations?
So we have a field investigation team,
Mm-hmm.
and occasionally they will request assistance from our monitoring and surveillance team, which I'm a part of.
Mm-hmm.
So I've gone on 3 EPICONs with them, assisting with setting up surveys for soldiers, assisting with note taking, doing focus groups, and I did lead I did a one-on-one focus groups. I did 2 sessions.
Right. Okay.
Hmm.
So, three different ones. For these field investigations, did you face any challenges or was it all routine?
I faced any challenges. Yeah, I would say I didn't really face any challenges because I wasn't a part of necessarily the planning of
Mm-hmm.
the consultations. I was more assisting with the
All
work
right.
that was, yeah.
But for these, you were also performing statistical analyses, right?
Yes.
So, what about that? Was that completely easy? Was there any challenges with that?
Um, no, it wasn't easy because when I started working, it was my first time working with administrative data.
Mm-hmm.
Administrative data can be extremely messy because
Uh-huh.
it's not collected for research purposes, and so there's a lot that's involved in terms of manipulating the data so that it's put in a format that can be analyzed.
Yeah.
So there's
Mm-hmm.
a lot of data cleaning that has to occur.
Okay. That's one challenge. All right. So, and for these field investigations, again, was it simply an analysis sort of thing, or were you also recommending something based on the analysis?
Um, I did not make any recommendations. Yeah.
All right.
Mhm.
Right. So in your resume, it also says that you did guide the development of an analytic plan assessing sexual assault perpetration. Can you elaborate on this analytic plan?
So that's kind of what I was talking about before. So basically, coming up with the study questions,
Mm-hmm.
coming up with the methodology for how, essentially, coming up with the methodology of how we're going to analyze the data, coming up with the data resources that we would use to get the data. Putting the write-up inside of our applications, the Public Health Review Board, and addressing any concerns the Public Health Review Board might have had regarding our analysis.
Mm-hmm. All right. So this is similar to that. All right. Um, right. We've already talked about the SAS usage. Right. So coming to the technical reports and your written communication, have you ever faced any challenges with that?
So right now, actually, I'm working on a technical report, and I've faced challenges primarily in terms of retrieving the data to support the report, and
Mm-hmm.
also coming up with a solid plan for analyzing the data. So I've had to in order to be successful with this report, I've had to go piece by piece, and patiently, and just practicing a lot of patience because a lot of the data came from outside of our agency. And,
Mm-hmm.
and so sometimes with dealing that, you might have communication issues, and being able to really openly communicate with other data stewards about what your requests are and what your needs are was important. And also doing a lot of research, background research, to try to understand the data elements that I would need in order to complete the report. So
Mm-hmm.
a lot of the data that I'm using is new data. I've never worked with data looking at initial military trainees. I don't have
Mm-hmm.
a background in that, and so I've kind of had to learn a totally new population and understand the nuances of the data that captures information on initial military trainees. So it's been
Mm-hmm.
a pretty huge learning curve for me, and I'm still learning today. And I guess being able to make decisions in order to be able to move the project forward and not get stuck so that the project is stalled.
Okay. So, would you say you've improved the process somehow, the documentation process?
Um, I think so. I think I've improved the process in terms of really understanding the population and understanding the nuances of the data,
Mm-hmm.
and how to better request the data in the future, and to come up with a template that maybe others can use um, when they're requesting data on this particular type of population.
Okay, so can you tell me more about this template that you've